Did you just have a child and you want to do everything you can to make sure that that child is as healthy as possible? And you've heard of tummy time. I want to talk about spinal structure and why tummy time is so important. Most people don't know when you're in utero, the spine from the top of the neck to the bottom of the neck is in a C shape. You call it the fetal position. The first curve in the spine that starts to form is that neck that's reversed in utero starts to get its normal backward C-shaped curve in the neck, which they call the lordosis, and that happens when the child learns to lift their head up but on their own. One thing you can do to help make sure that it develops normally, actually two things you can do, is make sure you leave your child on their stomach a lot, because that increases when they're having to hold their head up. It strengthens the extensor muscle tone in the neck. Second thing, if you had a child that had a forceps delivery, a vacuum extraction, or a very, very long labor where they were stuck in the birth canal, one thing that can cause the neck and curve not to come back to the way that it's supposed to be is they have a spinal misalignment from the birth process. In the upper cervical spine, namely this atlas where it fits to the skull, there's a structure inside of there called the brainstem, and it basically is responsible for postural muscle tone. So if a child has done all the tummy time and they've done everything correctly, often we get kids in that are 5 and 6 years old and they have straight necks or reverse necks, and it's because they had a trauma from the birth process, or early on the vertebra got locked and it didn't allow the postural muscle tone to function the way it's supposed to. Often these kids that have upper cervical misalignments have chronic ear infections, colic, they're very fussy. You know, a kid that's healthy, that's working the way they're supposed to be, they should be nice and placid and fall asleep rather easily. Yes, when they're young, they may not sleep through the night all the way, but your kids shouldn't be crying all the time, have colic, and have chronic ear infections and things of this nature. So if you come across this video, make sure you have your young child do lots of tummy time. And if things developmentally are not going the way they should, or you think your child is more fussy than they should be, or later in life they start to have speech delay or chronic ear infections or chronic tonsillitis, it is very highly correlated that these problems in young childhood are due to upper cervical spine issues. We've taken care of hundreds of kids over the last 23 years. They respond beautifully if they have a problem here with these types of problems. So if you've come across this video, we have an office in Sarasota, Florida. We offer free consultation. If you're outside the Sarasota, Florida area and you have a child that's having issues and this video has spoken to you, there's a website that houses upper cervical chiropractors throughout the world, www.uccnearme.com. If there's not a doctor on that site in your area, you can leave a comment in the comments section below for your city, and we'll be happy to find you someone in your area.